Just as a gardener nurtures the seed to grow into a strong and healthy plant, we at IAD use a combination of treatments from allopathy, Ayurveda, and homeopathy to nurture and take care of you, eradicating your lymphatic diseases. Our journey to provide you with the best treatment sees us collaborate with leading doctors from around the globe. Our chief mentor, Dr. Prof Ryan, Professor of Dermatology at Oxford, honored us with his presence recently.
Professor, what is unique about IAD's approach towards treating lymphatic diseases compared to similar situations globally?
Well, the IAD is using Ayurveda and yoga, which is not being used elsewhere in the world. And elsewhere in the world, they're using biomedicine, which tends to be focused on single causes and single effects, whereas Ayurveda and yoga is multifaceted, holistic, if you like, and biomedicine can learn perhaps some of its defects, which is it is not sufficiently holistic. It's not sufficiently multifaceted, and it can learn from what is happening in Kasaragod that by being multifaceted, by being holistic, you can add expertise and increase the good effect of your treatment. And that's exactly what he has done. More than 1,000 patients have responded very well to his therapy, which includes not only yoga, which addresses breathing, which integrates and brings together, synchronizes breathing, posture and movement. And then there are all the herbals of the Ayurvedic medicine, which add a lot of unknown effects. And then there's an additional factor that Ayurveda looks at the patient and decides what constitution he's got and prescribes accordingly. Whereas I think in biomedicine, we regard the patient having one constitution, and we're not prescribing for different groups. We're prescribing the same thing for everybody with elephantiasis. Whereas in Ayurveda, they see something in the patient which may divide him into the different subgroups, which receive different prescriptions. That may be important, and biomedicine may learn from that.
IAD has been doing some wonderful work for lymphedema treatment in India. What can we expect from them in future?
Well, India has the biggest number of patients with lymphedema, so that is one thing. It's been assumed that the lymphedema is due to filariasis, which is a parasite. But in fact, as we learn from the rest of the world, there are many other causes of lymphedema, which must be present in India. There's those who do not have shoes, but walk in irritant soil, known as podiconiosis. That may exist in India. There's the whole area of palliative care, in which people with cancer treated by surgery and radiotherapy develop lymphedema. And then about 1 in 1,000 persons will have congenital or genetic causes for lymphedema. Others will develop lymphedema due to immobility and paralysis. Now, if you have a population of 1 billion, and if we say that about 1% of any population will have lymphedema not due to filariasis or cancer, then if you take 1% of 1 billion, you've got an awful lot of people with lymphedema in India who are going to need to be treated. No doubt other places will have to develop, but I expect that the IAD, with its additional expertise in collecting evidence, will, at least for a while, keep its leadership, and will be necessary for at least a few decades as leaders in the field for lymphedema. It is not the only disease that can be benefited from integration, and already they're looking at vitiligo. It's a very serious problem and disability in India, and there will be other diseases which they can focus upon. And so I'm sure they have a great future developing leadership in these fields.